Greetings, everyone. Welcome to the 230th session of the online Optom Learning Series, OOLS. And for today's session, we have with us Dr. Naimah Ebrahim Khan. Dr. Khan is an academic leader and a senior lecturer at the University of KwaZulu-Natal in South Africa. She has completed a research master's in optometry, where her research was about dry eye tests. She has also developed a digital vision screener for South African primary school learners and earned her Doctor of Philosophy degree in optometry. By profession, I think she is a dedicated academician. She teaches undergraduates as well as the postgraduate students at the university, and has been presenting her research work and papers at national and international conferences. And with all experience, she has also won several awards. And she's going to talk to us about vision screening. What is its importance? How can we go about doing vision screening into our community and to the practice? So welcome, Dr. Khan, onto our platform. Thank you for joining us on the Sunday afternoon from South Africa to enlighten us about this topic. So let me just please leave the screen time to you.
Thank you. Thank you so much. Hello, everybody. Thank you so much, Dr. Baradwala, for having me on here. It's actually such a pleasure to be able to speak about vision screening, to be speaking about optometry, and to be speaking from South Africa to a global audience. So I am very grateful. I'm going to begin by just explaining whereabout I'm from. So for those of you who don't know South Africa, I'm from Durban. Durban is in KwaZulu-Natal province. It's on the east coast of South Africa. Many people probably know Cape Town because that's the more famous city. It's the more touristy city. But Durban as well, where I'm from, has a lot of different things that I'd like to highlight. So we're famous for our beaches. We have a very temperate kind of current. It's called the warm Mozambique current that flows along our shores. So you can actually go into the water and bathe in the sea throughout the year. Even in winter, I think our climate is very temperate. Winter for us goes to about 15 degrees Celsius. So you can still go into the water. We also have one of the busiest ports in South Africa. So a lot of the goods come into Durban. Durban and KwaZulu-Natal, I must say KwaZulu-Natal, South Africa, we also have a lot of wildlife for those people who are interested in going on game drives and having to see some wildlife. South Africa is famous for the Big Five. In KwaZulu-Natal, we also have the Drakensberg, the Drakensberg Mountains, or Drakensberg, known as Dragon's Breath. Very beautiful, lots of hikes, nice family activities, and many people stay over. They do overnight hikes in Drakensberg, quite famous for the Drakensberg Mountains. And that's actually in KwaZulu-Natal. It borders the other provinces. And one thing we're extremely famous for is something called the bunny chow. If you haven't had a bunny chow, you need to come to Durban to have an authentic bunny chow. It's not made of bunnies or rabbits. It's a curry that's placed in hollowed out bread. It's just a manner in which the people started eating it. But we're actually known for the bunny chow, and it's really tasty. So enough about Durban and about South Africa. Let's move on to what we came here to speak about. We want to talk about vision screening. So an overview of today's session would be we'd go through the definition, we'd talk about the background and significance, some barriers and enablers to vision screening, the role players, some practices around the world. And then I want to speak about Bona. Bona is something that I worked on as my PhD project. I'm also doing some more research now as a postdoc. It is something very close to my heart, but I'll speak more about it a little later on in the presentation. So what is vision screening? it is a brief assessment that looks for potential vision problems and eye disorders. And once you go through this, you're able to figure out if someone actually needs a full vision exam. So the point of vision screening is not to diagnose the problem, not to diagnose the entire vision problem, but just to figure out or give you an indication of the possibility of a problem. It's a very quick test. Why is it so important? Lots of people and lots of different organizations have reported that, lots of children suffer from undetected vision problems because of the lack of appropriate evaluation. So it's when we talk about vision, clear vision or your eyesight or the visual acuity is actually not the only requirement for successful performance of visual tasks. There's other things that need to also be checked, like scanning, focusing, the binocular vision or the alignment of the eyes, visual coordination, and a whole lot more that's sometimes quite overlooked. Why do we actually need to start off with child eye screening? So when I speak about vision screening, it must be noted that it can be done for all ages, for adults as well as children. But in the literature and throughout the world, most eye care practitioners speak about child eye screening. Why? Because we want to detect the problems early. Early detection of poor vision and refractive anomalies help us because then we can prevent these, the visual problems from continuing. We can act on it. Also, because there's something called amblyopia, which needs to be identified early. And why is that important? It's because of, children's neural plasticity changes, especially after the age of, I would say, about 6 to 8 years of age. So it's important to fix the problem or to detect it and try and treat it earlier so that it's not a long-lasting condition. Lots of things get left and after the age of the neural plasticity, and thereafter it's very difficult to try and correct. So take-home message is that early detection will actually lead to early intervention overall in society, whether it is in the poorer areas, the rural areas where there's not so many practitioners, whether it's in the affluent areas, no matter where in the country you are based, whether it's someone who's working in an office or whether it's children in school. Vision screening is applicable to everybody and should be carried out for all cadres. So some visual disorders like refractive error, amblyopia, strabismus, some juvenile cataracts, leukocoria, all of these things can be picked up if we make sure that children go through a child eye screening. Many countries have tried to incorporate this into, a school health program. Now, the World Health Organization Expert Committee on School Health has asserted that school health programs can be a source for the advancement of education, public health, social, and economic development, and that the global expansion of the programs, have shown how important this is. It attests to their value. But when they incorporate a school health program, there are many facets that they need to think about, and there's a lot that they need to incorporate. So it could be, the mental screening, it could be the physical screening, social well-being, everything that needs to be checked so that we can maximize the learning capabilities and help to improve the quality of life in general. So a school health program is something that's quite important, but unfortunately, it hasn't been adopted in every single country around the world. There are some countries that have a well-established school health program, and they have school health nurses that go out and are trained to check and detect certain characteristics. Amongst them could be vision. But there are other countries that are still working towards getting this, into their legal framework where they can have a formalized school health program. And there are other countries where it's a very ad hoc kind of school health program, where the nurses go out, but there are so many things that they're looking at, maybe even trying to develop the schooling program before they can look at the health of the school population. And that's when the community kind of needs to come through and assist government and assist the policies to ensure that vision care or eye care gets included in the school health programs. Now, there are lots of barriers that are around in terms of trying to have vision screening established and having vision screening work very well. Some of the barriers, I haven't mentioned everything here, right? But the most important ones in the literature that people speak about, some of them are the fact that parents and guardians actually have difficulty identifying children with vision problems. And this is a very big barrier to accessing healthcare at an early age. Because if the people that are around the child do not realize that there is a problem, how must a child realize that how they are seeing with their poor vision, how they are seeing is what everybody else is not seeing? For them, they feel everyone sees the same. They don't know any better. So the child is not able to tell you, that they're not seeing well. So it's up to those that are around the child, the caregivers, the parents, the guardians, the teachers, the people that they come in contact with, to be able to pick up that there could be a problem. And if you find that these caregivers do not pick it up, then it actually lingers, and that poor child doesn't know that they're not seeing how everyone else is seeing and can't reach out for help. Sometimes poor health literacy may be the problem. Maybe that's why they haven't been taught about health and what should be looked out for. Money could also be a problem in terms of the affordability and the inaccessibility. This could prevent communities from accessing vision screening programs. But there is also, in a lot of the communities, fear. Lots of fear that's present. Maybe they don't understand what we're talking about. Fear from eye damage. Lots of people say it was the older generation saying, oh, if you wear glasses, then your eye is going to get worse. Once you start wearing it, it gets worse. That kind of statement comes from fear. They're scared. And also family responsibilities, ageism, fatalism, all of those things come into play when we speak about fear. And it could also just be that in terms of vision screening or in terms of health, they're just not familiar with what it is you're doing. And one example I can give you here is, when I had gone out to do some vision screening with my students, for my PhD, I had a little girl. We were screening that day. We were screening grade Rs. So grade Rs are around 4 or 5 years of age. And this one child came running to me. She jumped on my lap and she was screaming and crying and holding on to me. And I was thinking, oh my goodness, what's going on? Why is she so scared? She didn't even go to my students. She came to me because she probably thought, well, this is the responsible adult. This is the teacher or, whatever. And after I got her to calm down and I gave her a lollipop and all that and checked what's going on, she explained to me that she had never seen, this equipment. We went there with the laptop. We went there with a few of the eye test charts and the vision screening tools. And she was scared because she didn't know what a laptop was. She was scared of the machine. She was scared of the chart. So all I did was I firstly opened up Paint on the laptop. I let her play with the mouse a little bit, get a bit more familiar and a bit more comfortable, with the laptop itself. And then I took her around. I let her feel the eye test chart so that she can see what it's about. Then she said to me, "Oh, it's like reading my book when ma'am reads the book." And once she got a bit familiar with the equipment, she calmed down and she wasn't scared anymore. And, she was able to get through the entire vision screening process. But of course, she was just so sweet and cute that she became one of my favorite kids to see whenever we went to the school. In terms of other barriers, sometimes when you prescribe glasses, when a healthcare professional prescribes the glasses, they're not always worn. Okay, lots of studies have proven that sometimes they're prescribed, but the child doesn't actually sometimes they don't get the glasses, but in other cases, when they get them, they don't wear them all the time. There's a lot of things that people are afraid of. They're afraid about how they look with the spectacles. It's a parental concern. They have this perception that the child's eyes will weaken with spectacle wear. Sometimes there's no encouragement from teachers for spectacles to be worn. And that is just something that needs to be reiterated whenever we go out to schools, because teachers play a big role. They're such a big role model for the students. And, they play a big role in everything. Shame, they're very, very busy teaching in the classroom, but they kind of pulled in different directions to do so many different things. And just kind of reminding them that particular child needs to remember to please wear the specs. When they're doing visual work, they need to have their glasses on. It goes a long way. You find that there's also something called teasing and bullying in every society, whether it's the poor income area or the affluent areas. Teasing and bullying occurs everywhere. So it's something to just look out for, especially when you're doing follow-up checks after the vision screening, to make sure that the child is comfortable in their environment and that there's no bullying and teasing happening. So it's important to follow up and always make sure there's compliance for the wearing of their spectacles. One solution to quite a few of these barriers would be to just ensure that there's, some sort of eye health awareness that's done, health education that's done, and invite teachers, parents, all children, all of them, if you're going to a school, gather all of them together, not just those that need glasses. Let the others understand why someone's wearing glasses. Something simple as that can be big change in the society behavior towards wearing spectacles. I have to mention this barrier in terms of, cultural practices. Here in Africa, especially, we have this come up quite a few times when we go out for vision screening, where, traditional eye medicines are used, and sometimes really, they just don't listen to advice from the eye care practitioner or the nurses, and they prefer to use traditional eye medicines. So the eye gets damaged due to the cornea being exposed to microorganisms, which leads to infection. And it has been well documented, the problems that come through. Some remedies are harmless, okay, but others, like, they instill infusions made from vegetable matter, human urine, which may be infected, hot oil, or products that are acidic or alkaline, which could cause trauma or corneal infection. All of these things can be very, very harmful. They can cause anterior segment disease, resulting in delays to eye care. There are many reasons, okay, that people or that practitioners face, the barriers that they face, for them taking on these things. Some reasons could be that there's greater accessibility for patients, or there's inadequate eye care services in the region, Because sometimes when you're doing vision screening, and if you go out to rural areas, you may just be there only for that particular day, or that particular week or something like that, and maybe something happens later on, and the child needs help, and traditional healers then, are the people, or the place that most parents would end up going to. So they may just find that there's also better communication between the healer and patient, and that also has to do with the language barrier. Language, there's many different languages out there, and that's something to think about when you go out for a vision screening, to ensure that you have a translator with you, or someone who can explain it in a simpler manner if you're not able to do it yourself, for the community that you're going into. Cultural beliefs also make a very big difference. I was mentioning earlier, in South Africa, we have many different cultures, many different areas. It's a melting pot of cultures. We're needing to always be very cognizant of each other's cultures and what people believe. There are certain cultures that believe if you look someone directly in their eye, when you're talking, especially an elder, it's taken as a sign of disrespect. Whereas in other cultures, if you don't look someone in the eye when you're speaking, it's taken as if, you're not confident, or that you're not able to speak properly. So it's very different in each culture. For some cultures, they feel that you're needing to, when you meet someone, you should shake their hand. And in other cultures, they would, especially with the elders, they'd say, do not shake hands. You'd rather look down and nod your head. So whichever area someone is going into, you have to be cognizant of the cultural dimensions in there. There were times, even when I went through for my PhD research, where I was trying to get, consent. And there were some rural districts that I went to where I got consent from the Department of Education, and I had consent from the Department of Health. But the principal of the school didn't want to sign off consent for me to conduct a vision screening until the leader of the community, the cultural leader of the community, signed off. So I had to go in front of it was like not really a tribal committee, but they were a group of elders. And I also had a language barrier, so I took along one of my students who were able to speak the language properly and to translate what I was saying. But I must say also the tribal leaders could speak English. A lot of them understood, and we were able to communicate. But I think they also took it as a major sign of respect that they acknowledged the respect that I gave to them by bringing someone from their native tongue to explain what it is that we were trying to do and come into the school. So that was something I hadn't expected, because I just thought if I had gone via the normal legislative route, of getting permission from the principal and from the Department of Education and Department of Health, I would have been fine. But in that particular community, I had to wait. The cultural belief was that the people of the community leaders had to say yes first before I could actually continue with my vision screening. And yes, they were very appreciative that we had come through. And, later on, I had gone back to also check up on, do like a follow-up visit. And I was always welcomed in the community. Once they understood what it is that we were trying to do, they were more appreciative and understood, let's follow through with the advice that they were getting, from us. So being able to identify the different portions and get through the barriers before beginning your vision screening is very important for you to have success for the entire program. Okay, now around the world, you find that there's lots of different things that occur. Vision screening protocols differ. The implementation differs around the world. Lots of people talk about the frequency, especially with child eye health. When are you supposed to test them? That sort of thing. So the frequency of vision screening changes, the ages of testing changes, the methodology of the tests also changes, all the different tests itself, and the administrator of the screening also changes. But everybody understands, or lots of people are, they concur that vision screening is important. It's been emphasized and formalized in a lot of the developed countries as compared to the developing countries, because most of the developing countries, they're spending a lot of time to try and still get this incorporated and fixing other societal problems before they can get to this. And some of the vision screening is administered by school nurses, teachers, or eye health personnel, or even allied personnel. So there's variation across all countries, and even amongst the different areas within a particular country, there could be differences as well. Some of the factors that we must consider when we talk about vision screening, like the time frames, the age of the vision screening would vary, the location of testing. So in some areas, we talk about schools, community centers, the health professionals' offices itself, other factors like the vision screening staff, who's going out to actually do the vision screening? Are they teachers, eye care personnel, nurses, other health practitioners, lay people that have been trained to do this, to actually do a vision screening? Also, the target conditions are different. You find that in some vision screening programs, they want to only look at visual acuity, refractive error, pathologies, binocularity, amblyopia, strabismus. So some programs would use a barrage or a battery of tests, whereas other programs would only want to check one thing, one of these conditions. But that's okay, because it depends on the area or the country that you're in and what is the need for that area. So vision screening should actually change according to the area that you're in and what the need is in that area. Because you'd rather check for what's the prevalent condition and what actually needs to be tested, right? Doesn't make sense to go and test for something else that's not necessary. And also, if you're targeting the need, then you can actually limit the time that you're taking, and you can actually see more people and more school children, more children during that time frame. More people can actually be screened, so it's easier for you to pick up the problem and intervene. The criteria per country also is different, whether it's legislated, whether it's ad hoc. Is it something that's actually recorded? Like in some countries, you get the children have like this, when they're born, they get a health book that they normally would take to the clinic, and the nurses would, take their height, weight, all the anthropometric measurements. They would keep a record of all of the different vaccines, if they do vaccinations, those sorts of things. So in some countries, even the vision screenings are recorded in that book. So the child has a recorded kind of the entire eye health history is recorded from the time they're born. Whereas in other countries, it's not recorded at all. It's done. It could be legislated, but it's not kept, So if maybe the school would keep it. And so if that child moves to another school, then all of the information is lost if the parent didn't think about, trying to retrieve it before moving. Okay, and as mentioned, the battery of tests is also different per area. Then something quite important, because we must talk about who initiates vision screening. Because everything costs money. Everything costs money. No vision screening is free, where there's no money attached at all. You may not charge, the people that you're going out to screen, but you still incur costs in terms of your personnel, in terms of your equipment, in terms of your time that you're going out, in terms of your transportation, all of those things. So who pays for that? And a lot of the times it's paid for by whomever has initiated the vision screening. So has it been initiated by government, by non-government organizations? And, there's a lot of NGOs throughout the world that are doing very good work, very, very good work. A lot of their budget goes to vision screening every year. Their annual budget, they have like an amount dedicated for that to be able to go out and do vision screening. Sometimes it's initiated by schools who then approach, healthcare providers or even optometrists or even eye health people. And eye care personnel sometimes would initiate it, especially if you in an area and you want to go through to your community and you want to provide a service, that happens quite often, where you find a lot of the eye health personnel going out and dedicating their time, to kind of ensure that their community is taken care of. Very, very well established people, very well established kind of practices have their own eye care wing, who are more of the community-based portion of it. And then they also have a retail wing, where the retail is more within their formal retail shops. But it's very encouraging to note that some of the more formalized teams of optometrists have actually thought about this and ensured that there is some sort of service available. So this is just some idea or some conditions, that can be picked up with the vision screening. You can pick up, the binocular imbalances. You can pick up problems at the back of the eye. You can pick up even congenital cataracts. A lot of these things sometimes just creep up, and it depends on the area that you're in. You would kind of know what's most prevalent, and as an eye care practitioner in that area, you'd want to go and actually look out for that specific condition. Okay, so some vision screening tests that are done. So visual acuity is the ability to see clearly. Sometimes you want to check the eye focusing, eye tracking, eye teaming, your eye-hand coordination, and visual perception. So here it was the American Ophthalmology Society, actually, who have recommended this battery of tests. This, we know it can't be done in every community to do all of these tests. Sometimes you can only go through and do a visual acuity, and it's enough, to pick up the need. So it just depends on the area that you're in and what comes up. In terms of methodology for a vision screening, we generally want to find something that's portable, quick, simple, something that's ecologically valid for the area. You want to have lots of people are moving towards digital vision screeners these days. And there's also teleophthalmology, which is becoming really, really common. Okay, it's a favorable practice. Lots of people are trying it out. Some other screeners that have been around, these are the older screeners like your Vera Vision and the Thomson's Vision Screener. These were used previously. These were the first types of digital screeners that were around. But I can't do a vision screening presentation without speaking about Peak Vision. Peak Vision is actually present in a lot of countries, and they're doing very, very good work. Here it's portable, and it goes through. It's an entire kit. They also have like a retinal, another little device that you can add on to your phone camera, which then allows you to view the retina as well. So they're doing very good work with Peak. Okay, so that was just a brief overview. But now I want to speak a little bit towards the, a little bit about my PhD and my vision screener. My vision screener that I developed was called Bona. Bona is a Zulu word, isiZulu word. We've got 11 official languages here in South Africa. Yes, you heard right. 11 official languages in South Africa. In the area that I am and my province, KwaZulu-Natal, the main language, other than English, is isiZulu. And with Zulu, the word Bona means to see. So my vision screener is called Basic Ocular Ngane Assessment, or BORDA. It is a computer-based vision screening application. At the moment, it's available to be used for grade R to grade 3 students. And it's based on our guidelines, because here, optometry in South Africa is a regulated profession. And we are regulated by the Health Professions Council of South Africa. So they have put out vision screening guidelines that we need to follow, different things that we need to check. And Bona tried to comply with most of what they asked for. So there were a few things that I tried to solve, okay? The supply versus demand, the fact that we don't have enough, there's a limited number of optometrists that are available in South Africa. And so here Bona helps because it can be, you can train other personnel to use it. You don't need an optometrist. Ease of access. Generally, we struggle in our area to actually go to the rural areas to test vision. There's limited personnel, very poor access. We also have problems. When I say access, I'm also talking about roads, right? Access in terms of getting into the different areas, access to be able to go through to the communities, like I mentioned previously. So here, Bona is universal. It can be used on a computer. It allows more children to be screened for eye problems at a faster pace and to pick up problems earlier, early identification. Also, it incorporates targets that are familiar to the South African children. Because when I developed Bona, what I had done was I went through and looked at the books that the schools use, the public schools. We've got something called the Blue Book series that they use in schools to teach the students. And I used familiar targets from their Blue Book series to develop the vision screening. So, they're used to seeing a butterfly. I incorporated a butterfly into the vision tests. They're used to seeing a ball. They're used to seeing, chicken. They call it nkuku. That's the Zulu word, nkuku, chicken, bird. So I've incorporated that into the vision screening so that the kids, when they're doing it, they think they're playing a game. And it's also something they're familiar with. When they're being tested, they don't have to be so scared. So the unique features and benefits of this is that it can be downloaded. It runs on a standard Windows-based laptop with basic accessories, absolutely basic. The reason for that is because we found that at least every single school in South Africa has at least one desktop computer. So, we can run this thing. And the fact that it's digital, it's you can do your enhancements remotely. It saves time because it takes about 6 minutes with Bona to do the screening tests versus the traditional method takes around 10 minutes or so. It can be quicker. It depends on the child and depends on the person actually administering the test. And as mentioned, it has child-friendly targets. And I thought that was very important because when I was an undergraduate student and we had gone out to do screening, I remember at that stage having problems where the child kept saying, I was doing a children's vision screening, and the child kept saying they can't see, or like they didn't know what the object was. So it was a picture of a ship. And just to give you context, for people who stay inland, if you've never seen a ship before or a boat before, you won't know what that is. So the point was the child, it's not like the child didn't know couldn't see the target. There was more a case that the child was not familiar with what was on the chart. And so visual acuity could be wrong if you don't pick up these things. So I was quite fussy when I was doing my own research to ensure that it is something, the change needs to be there, because if I'm developing something for my area or for children within South Africa and Africa, it needs to be things that they are familiar with. I'm sure other eye care practitioners, when they go out to the areas that they know, or they have an idea as to the ecological considerations. What is the population used to? What do they know? That's what they will use when they are testing. Yeah, so just a quick overview, it is run on a Windows-based computer, as mentioned. The input is made by the examiner. Each test will give you pass-fail criteria. A report is generated at the end, which indicates if the vision screening was passed or failed. So when we start off the program, I just put a couple of screenshots on here just to give you a quick snippet of Bona. We do a calibration initially for color, language, and the screen resolution, because when you're doing it on different machines, the resolution is different. And for the test to run correctly, you need to have the resolution standardized in order for it to work properly. And the different tests that I've included in Bona are pursuits, visual acuity, contrast sensitivity, the AMP of AC, TVAS, because perceptual skills is something that's quite important for us to test, Worth 4-dot, and a color vision test. And my color vision test, just to give you a snippet, is a butterfly. Okay, makes use of a butterfly because there's a lot of butterflies in the Blue Book series that our students use here. Report is generated at the end, and you know whether the student has passed or failed, and then you do an appropriate referral thereafter if necessary. So this one just shows you the screenshot of a past screen. Okay, so overall, summary steps to establish vision screening when you're wanting to establish a vision screening program in your area. Some things that I think are golden tips. This is the golden tips. You think about the situational analysis of the need. You go out, you figure out what is needed. You think about ecological considerations, the area that you're in. What do you need to think about in terms of the cultural variations? What do they know in terms of the targets, those sorts of things? Access and barriers, identify them early enough so that you can already put a plan in action to mitigate the barriers. Legislation in your area. If you're needing to get permission, and whether it is a legislated thing, whether you need to put a form in, rather do it before you start. Time frames, how long do you have, and how often do you go out? What types of tests do you want to do, and what conditions are you targeting? Location, where are you doing the vision screening? Personnel, who's going out? Who's your team members that will go out and actually do the testing? And then referral pathways are so important. You can't go in and do a vision screening and then you don't have any way of fixing the problem if you find it. So you need to have a proper referral pathway identified before you even start your vision screening, and figure out your intervention strategies as well. That's very important. How are you going to, if you need to give them glasses, or spectacles or whatever it is, the therapy, who's doing it, and how do you move forward to get it done? Okay, and I thought, let me just put some pictures here. So this is me with one of the vision screenings that we had gone through, a couple of screenings. This was when it was a community-based screening. There's some of my students and myself out there doing some screening. Here as well, this was another one that we had gone through too, and some screening activities that we did. And this is me with my class. I think this was the 2022 class, half of them. Yeah, this is me with half of my 2022 class when we had gone out to one of the schools to do a vision screening. Yeah, thank you very much. That's it from me. These are my references.
Thank you, Dr. Naimah, for that brief overview. I think it's really important, as you say, vision screening plays a very important role to detect problems early and help to manage patients at an early stage. So thank you for sharing all that and sharing your developed protocol application, I would say, the vision screener with us today as well.
Thank you.
So great. So I think there was one question which came in, which talked about, you did cover it during the talk as well, but just to ask, how many patients do you normally target to see in a day when you do vision screening? You did say about 6 to 10 minutes per patient is what you kind of uh, take to examine a patient. But what is your target? How many patients do you think we should be seeing it in a day when it comes to vision screening? Is there a specific number? Is there any recommendation?
So I think the way to answer that is, look, I've done very many different types of vision screening. And it just depends on the number of personnel that you have with you, as well as the types of the tests that you're wanting to do. There are some people that prefer to use automated vision screening, with instrumentation. With those ones, you can go very quickly. You could be able to get through, you take probably around 2 to 3 minutes per person then with an automated screener. And, you can get through in a day almost 300 to 400 people, depending on how many you have, especially, your personnel. Then there's other screeners that you go through and you've got a battery of tests and if it's taking you 6 minutes, it depends on how many people you have. Now, with us, in a lot of my screening activities, I like to encourage my students, my undergraduate students and postgraduate students to come along as well, help in the community. They must understand why we're teaching them these different things. They must take the opportunity to go out and see the pathologies and to interact with people, the community, and understand. And if you take them along, I find you get much more done. They also have much more energy than the older folk, they like charged up. They move from one station to the next station to the next station really quickly. So sometimes we can target at least 200 to 300 people in about 4 hours, 4-hour session in the weekend, depending on who it is that we see. It just depends on what type of screening we're doing and who we actually testing, kids or adults.
Right. And then there is one question regarding the screeners. What is your experience in using the standard Snellen chart versus a screener test? Like, for example, we have all these screeners which kind of do the vision assessment faster. Do you think that they are better, or you think a standard Snellen chart is better to kind of get a proper result, or you think both are quite comparable?
Oh, that's a very controversial question. If you look at literature, a lot of the literature says that we shouldn't rely only on visual acuity.
Correct. Yeah.
Actually, when we look at literature in terms of research, and when you look at what happens actually on the ground in a lot of countries, it's different, totally different. In a lot of countries, they do rely only on the visual acuity chart. And depending on the expertise of the person administering it, they're able to pick it up. Yes, some of them are very good and they're able to quickly pick up problems. Whereas others would, rely more on a battery of tests because they feel that just visual acuity is not enough. So I think it depends on the area that you're in and which country you're in. Like in South Africa, only using a vision screening or visual acuity would not be enough according to the HPCSA guidelines. For us, we mandated, because we are a legislated profession, we're told we must make sure that we do a battery of tests, especially for children. Whereas in other countries, if you're not legislated, but if you have a very, good screener, somebody who's administering the test who has a lot of experience, they are able to pick up the problems. Yeah. So I would say for a novice, just visual acuity may not be enough. You also need to ask, you have to have a good case history going as well. Sometimes just from talking to the patient, you already kind of, you suspect that this could be the problem. So it just depends on the area that you're in. Yeah.
Correct. Yeah. I kind of agree that vision can't be just an alone test to determine your referrals as well, because as you said, once you do your screening, you need to have a channel or pathway what do you want to do? Do you want to prescribe glasses or probably send for a proper refraction, or this particular patient needs an ophthalmologic evaluation, binocular vision assessment, or whatever it may be. So I think just relying on vision, you might have a lot of false positives and false negatives, and you will
Yes.
kind of make the clinic pulled in with patients which maybe not required there. They might have another place to go. So I guess that's really important. Yeah.
Yes. Yes. Yeah. What you
The
just
other
mentioned
question.
now, that backlog is important to fix
I mean,
because you
that's
don't
the whole
want a
reason why
backlog.
we do screening in the first place, also at most of the
Exactly.
time, right? So we want to pick
Yes.
up the appropriate candidates, if I may term them, and bring them into the proper examination so that we save a lot of time and efforts.
Yes, exactly, Doc.
Yeah.
Oh,
The other question which comes up here is most of the countries have this international optometrists going around, this one sight savers kind of thing where they do a lot of vision screenings and things like that. Have you had any experience, and what do you kind of have in terms of any opinions about that?
so yes, in our area, we've had a lot of some other optometrists that have come through to do some sort of screenings. But most of the time, when they come to our area, they actually reach out to us at the university
Local
because
partners,
we're the
yeah.
teaching. Yeah, they partner with us, and they actually invite us to join them, which is really nice of them, because then we're able to give our students that experience, to go out with them. A lot of them also provide, like if they're going to the rural areas, they provide accommodation and things like food and whatever for our students whilst they go on these camps, the vision screening
Yeah.
camps. So you look, we encourage others to travel around, all eye care practitioners to go through and figure out where the need is, and if they can go out to the area and if they can help, why not?
Right.
It's nice. It's a good experience. Even our students, I mean, we've got something called the Pelo Pepper Health Train. I'm not sure, Dr. Barodewala, if you're familiar with that. Are you familiar with the Pelo Pepper Train?
No.
So the Pelo Pepper Health Train is something that it's initiated by the government here in the country, and Transnet, which is the main sort of railway people. So there's these two trains that travel around the country, and they provide health care for the communities. They go to different areas. So on that train, it's like you've got the dentists there, you've got nurses, doctors, optometrists,
Full head screening.
and
Yeah.
we have like a lab also, so we can make up the spectacles in there. So our students from the different training institutions get a chance to also do 2 weeks on the train. They stay on the train, they go through to different areas, and they're able to also do vision screening, as well as if they need to do full eye tests, and they do full eye tests, and they make up spectacles as well one time while they're there to give it to the community. So the Pelo Pepper Health Train is a good example of that, and we get a lot of international guests who come through to spend time on that train and travel around the country, also assisting. It's a
Something
cool initiative.
probably similar to the Orbis Flying Hospital where they do
Yeah.
surgeries and all that. So this is
Yes.
more of a screening kind of thing where, yeah, it's a
Yeah.
wonderful idea. I think there are a couple of, what I know is in this part of the world in Asia, there are a couple of vision screening, uh, I would say vehicles. They have their own vision screening buses, and they kind of modify it into the screening bus where they have the autorefractometers, the slit lamps, and the refraction lanes. So these buses can travel through some remote areas at least, and then they can do the screening. They can do the entire vision assessment, and sometimes they can even do refractions if permitted, and they can also prescribe glasses as well. So yeah, I think these kind of projects would be very beneficial for the communities which are hard to reach, and provide them with care and with what they need in terms of vision correction at least. Yeah.
Yeah, definitely. That sounds really cool. We also, in Cape Town, the Gift of the Givers, Dr. Imtiaz Suleiman and his gang, they actually did start something like that. And they've started with the eye people as well as hearing. So they go out and they do, vision and ear screening. And you're right, it's like a bus and they go through to the different communities there. It's really cool. It hasn't hit KwaZulu-Natal as yet, but it is being done in the Western Cape of South Africa. I do know that. It's good.
Great. All right. Another question which kind of came up is asking about vision assessment. So, when it comes to screening, do you prefer to do it monocularly or is it done with the help of filters, which may help to save time? Any thoughts on modifying probably, the vision assessment test? Do you prefer to modify it by using some filters, or you would do a standard assessment on how we do it in the clinic?
Yes, so this is quite an important question. I think it depends on who you're screening. So if you're screening a child, most times, if you want to do a quick assessment, most people like to look at, the younger patients, they like to look at the near visual acuity because you're more worried about the near triad. And if they have a problem with that, straight away, you're able to say, okay, you need to have a full eye test, If you're doing that at distance visual acuity with a child, you may have to worry about accommodation playing a portion there. So many people pick up a +1 or a +2 lens and hold it up and say, do the testing. The other thing is, if you're doing a presbyopic or a pre-presbyopic community that you're screening, you're going to be worried about the nearby because they're going to come in already telling you that their hands are too short, So you're probably going to go straight for that, just checking to see nearby. Are you having issues? Like if you're going into an office complex to do the vision screening, many of them will tell you, their hands are too short. You go straight for that and check for it. In terms of the monocular and binocular VA, the literature speaks to this quite a bit. A lot of the vision screening that's currently done or has historically been done have been done binocularly. And the problem with that is that if there is a problem with one eye, the other one's compensating already, you're not able to pick up the problem, So it's not nice to do it binocularly, even though lots of times previously it has been done that way. But I must say the digital vision screeners that are out there now pick up this thing quite quickly. So one way to circumvent this problem and the time constraints that it takes to do each eye is to use a digital vision screener, I would say.
Right. Wonderful. Great. And the other question is regarding, getting help from fellow colleagues, for example, school nurses, teachers at school. Do you think that would be something which will help us in, kind of screening? And what age group do you prefer the screening to start with, if you would want to comment on that as well?
So there's two parts to this question. The first one about getting your allied health people involved, very important, because as mentioned previously, whomever the person or the child comes in contact with first, it could just be the nurses. They go to the nurses to get their vaccines, all of those things. It's important to give them some sort of eye health knowledge. Yes, they don't need to know how to do a full refraction or whatever, but if you do some sort of eye health campaign with them, where you just explain, this is what you're looking out for in this age group. This is what's important in that age group. If when they're crawling around, it's a child bumping into objects, do they have bruises on one side compared to the other side? You're going to worry about whether there's a deficit, on the one end, one area compared to the other. And it's the same thing even in the elderly, because with elderly patients, you find sometimes they bump into objects on one side compared to the other. Maybe they're developing a cataract in that area, in the one eye compared to the other, those sorts of things. So the allied health people, like the nurses and teachers, are so important, and it's very important to get them on board and make friends with them. I must say that we must learn to work together as a health community. We can't stick to only eye health people and say, this is my box, I'm staying in my box, I'm not talking to the other people. It doesn't work like that. In a societal kind of total community-based health program, you need to have everyone's help from all sides. So it's nice to invite them and to make them welcome by explaining what they should be looking out for. Then secondly, age group to start off. So normally when the child is a toddler, you do basic tests where you're just wanting to see if they could see. Like if you put something in their hand, like the teachers would put, what are they called? Those little sweets and whatever in their hand, different sort of sizes. Something simple like that to see if they're able to pick it out. They're able to see it. It's a basic, not even a screening. That's just to see if there is a problem or not. But I would think to go out and actually start screening would be from 3 years of age. 3 years of age, definitely. Should go out. That's in a lot of people, a lot of countries, that's when creche starts, the child care starts from 3 to 5 years of age before they start formalized school with grade R. So that's the nice time to start, pick up the problem. And, then they're not too small where they're going to start crying at every little thing, but you can find age appropriate tests for that age group, and figure out if there are issues or not.
Right. Yeah. And I think we'll take one more question is the use of key cards when it comes to vision screening. So what is your take on that? How reliable are they, or would you recommend using them? Any experience on using them as well?
Yes, this is a good question. So I think it also depends on the test, what sort of visual acuity chart you are using. So because laterality, remember children's laterality are only kind of developed after the age of 7. Before the age of 7, they're very confused which is left and right. So if we have to use like the E, they're not going to know. You're going to ask them, which side is the table legs pointing? That's a familiar way that we would say, we talk about the E as a table. And then if they say left or right, they're not going to know. So using, key card is really cool because they're able to match, they learn matching. When they're in the school phase, they do learn matching. So you can use that to kind of help them to figure it out. But I wouldn't say use an illiterate E or the Landolt Cs. You'd rather use the picture cards, like your Lear symbols and things. And even that, it comes with the Lear symbol comes with the key card. So I think it's got an apple and all of that. So they're able to match it. They know what it looks like and they can point out. So even if it's a person, if it's another language, if you're not familiar with the language, you're still able to do a visual acuity test because they can pick it up. So key cards are important. Sometimes it confuses the child if you don't explain it properly. But I found if you take time to explain to them, they're going to match it. They're doing matching. It does work really well. I get them comfortable before you actually do the test. Then they're fine with it. And I like to also use nice occluders. So I find out in advance, do they like Mickey Mouse, Minnie Mouse? Do they like Smurfs? Do they like, depending on, all these cartoon characters. And we make pictures and we stick it onto the occluders for them. And we're able to put it on with an elastic band because they can't hold occluders. No, you can't trust that with the kiddies. So we put it on with the elastic band, and that's how it helps you to do the visual acuity with your key cards.
Right. Yeah. Awesome. Great. And I think one question just popped in, and I just take that is regarding the referral system. So you did mention that once you have a child who needs some help and you want to refer for ophthalmological or optometric evaluation or binocular vision assessment, whatever the things would be, what are your tips probably in making sure that happens? Do you kind of do a follow-up, or do you have a system in place where you are sure that they went and did the examination? Do you provide them with the support of transport, and what are your thoughts on that?
Okay, so yes, that is very important. It depends on the visions, which vision screening I'm doing, right? So I'll give you different examples. For some examples with the NGOs that we work with, this is already built into the costing when they went out. So they already worked out, okay, if we have this 50% of them that actually are going to need glasses, this is how much it's going to cost. They build that in, they'd be able to cover the costing for that. And most times, they also then hold a camp to do the full test and make up the glasses one time and ensure that they get it, right?
Yeah.
Other times where you've got to send them off to an ophthalmologist or to a hospital, then you'd write the referral letter, but you'd keep records, and you'd have somebody within that organization who would do a follow-up to make sure, call back and say, sorry, Mrs. So-and-so or Mr. So-and-so, you came in for the vision screening. This is just a follow-up to double check. Is everything okay? Did you manage to go through to the primary, to the hospital? Did you manage to get an appointment? Do you need any other assistance, any help? That following up is very important. They feel important and they know that you actually care. And the other way to do it is to contact the provider yourself and make a block booking for if you know you've got a few of them, you've picked up maybe 5 of them that need to go to an ophthalmologist. Call the ophthalmologist in the area and say, we did a vision screening. There's 5 of them that need to come and see you. Please advise, when can you fit them in? If you already from your organization make the appointment, and then check if the person is able to go through. That actually helps with compliance. And then the other method of doing it is, a lot of the school vision screening protocols these days incorporate the digital age, where it's all done by SMS. They'll remind you. You'll send. You came in for a vision screening. You needed to go through to the ophthalmologist, or you needed to go through to get your glasses made. Please advise if it's been done. Click yes or no. Click 1 for yes. Click 2 for no. Have you done it or not? Like an SMS sort of system. Or you can, if it's a child, you can SMS the parent. Or if it was done in a school, then the teachers keep the record. But the follow-up care is important. And I think the responsibility of that follow-up and the intervention actually falls on the people that are doing the vision screening.
Yeah.
It's not enough to just inform, if someone needs the glasses. The responsibility falls on the vision screening personnel. So yes, that follow-up is important and tracking. Yeah.
That's right. Yeah. Even if you prescribe glasses or you give them glasses, I think it's good to go after 6 months and see how well are they doing with glasses and making sure that things are in place. Is it improved or things have got better or not gotten better? So you could help them more. So I think follow-up care is kind of it's kind of an important part while planning your vision screen. Like how you said, you need to have a budget aside for how you're going to help them later on after you found that they need some help. So what are the pathways, and have that in place in your budget so that you kind of make sure it happens, and following up would be a great thing to do as well. Yeah.
Yes, definitely.
Awesome.
I agree.
Yeah. So I think with that, thank you so much, Dr. Khan, for that wonderful insights about doing vision screening and sharing the thoughts with us today. Thank you so much for your time.
Thank you. Thanks for having me. It was really, really nice to speak about vision screening. As you can see, it's something that's very close to my heart.
It is, yeah.
I love working in the community, and I love going out and also showing this passion to my students. So yes, I hope everybody goes out and does some vision screening, and I wish them well in whichever community they're going out to. Thank you.
Sure. Thank you so much for that advice. And to draw your attention to one of the events which we have planned in India, this is specifically in terms of scleral lenses. So we have Euro School, which is led by Dr. Dadi Fadel. She is keen and kind again to come to India to deliver her expertise and share her knowledge with us. And it's happening in 2 locations in India. So we have sent out the brochures details about this particular event, which is going to happen on the 18th and 19th of May, physical as workshops. If you are interested, please reach out to us and we will be happy to share more details. The link about it is also shared on the chat. Please feel free to write to us if you need any more details. So take care, everyone. Be safe. And to those who are going to celebrate Eid, happy Eid, which is going to fall in a couple of days. So happy fasting, happy Eid. Take care and be safe. Thank you, Dr. Khan. Take care.
Thank you. Bye-bye.
Bye.